Hello, my name is Carolyn Hunter Lane, and I'm an assistant professor at the University of Arkansas at Little Rock School of Nursing. Today, I'd like to share with you some ethical principles and professional integrity in our nursing practice. Here you can see the particulars to the disclaimer regarding this presentation. The objectives today: after the participation, the participant will be able to apply knowledge of ethical principles of patient care, identify the ethical principles of the nursing profession, explore the common ethical issues in general and in one's specialty, exhibit competence in analyzing and resolving ethical problems, identify challenges and resolutions in nursing ethics. So for those of you who are participating in the webinar, we know there are so many individual situations and everything is not textbook. Everything is not just a black and white resolution and answer for us. And maybe for one time and maybe not for the second time, even with something that is almost mirrors one to the other. According to the American Nurses Association, the Code of Ethics for Nurses Imperative Statement, the code, the nurse has authority, accountability, and responsibility for nursing practice, makes decisions, and takes actions consistent with the obligation to promote health and to provide optimal care. Key words here are accountability, responsibility, and that we do have the authority. Today I would like to talk again from the reference of the ANA's Code of Ethics that notes that nurses are responsible for an environment that demands respectful interactions among colleagues, and that all team members must be treated fairly. Lopez in 24 states that recognizing and addressing our biases can help ensure equitable care for all patients. I would just encourage all of us to have that self-reflection and really look at how we handle situations, how we may think of others, and just really make sure that we're on sound ground when we're working with others and certainly in the care of our patients. According to the ANA's survey of over 7,000 nurses, today nurses are feeling stressed, frustrated, exhausted, and overwhelmed. Nurses' experience of stress and burnout is not a new phenomena, as we know. The strengths and perspectives as we look at multi-generational nursing workforce allow healthcare organizations to enhance patient outcomes and improve nursing retention. Again, this is looking at maybe any biases that we have, any things that, that we could have that could prevent situations from being with the best outcomes. Bioethics and healthcare ethics are sometimes used interchangeably in the literature. Bioethics is a specific domain of ethics focused on moral issues in healthcare. It evolved into a discipline all of its own due to life and death moral dilemmas encountered by physicians, nurses, other healthcare professionals, and patients. The structure of the ANA Code of Ethics is to support challenging and questionable values and conflicts that arise in everyday practice. Nurses regularly face patient care situations that can challenge their personal and professional moral code. Some of this may resonate with those of you who are attending or listening, and I would again ask you just to do that self-reflection and how did you handle the particular situations? What would you change? What would you do differently? And maybe capitalize on what you did that was for the best interest of you, your colleagues, the patient, or whatever the situation may be. These situations not only have implications for the safety and well-being of patients and their families, but also for the nurse's personal well-being. I talked again about self-reflection, and past reference, I taught ethics for a company, and through the tests that we would come and bring to those who were attending were the skunk test, the child test, and the newspaper test. The skunk test really says, have we done anything or something that we're getting ready to deal with? Does it have a certain smell to it? Does it not just seem to be exactly right? And should we steer clear of it? And when we call it the skunk test, we know that some of that can linger, can continue to be with us. So we want to be very aware of what maybe appears to be not the best choice or what a situation that we may need to seek help. The other is a child test. Would I ask my children, or would you ask your children, or people that you care for, to do particularly these particular things, and what decisions you would encourage them to make? The newspaper test. Would I want that decision, my behavior, the circumstances, to be in the newspaper the next day? Unfortunately for these, I can tell you that I've done things that probably were not of the best odor, did not smell exactly right. The child test, I've done things that I would not want my children to do. And the newspaper test, things that maybe choices I made, behaviors that were recognized that, again, I would not want in the newspaper. When we look at the American Nurses Code of Ethics, there are 1 to 10 provisions. 1 through 3 is nurse to patient, 4 through 6 is nurse to nurse, 7 through 9 is nurse to society, and provision 10 is new. I'm going to go through these a little hurriedly. I will tell you that the ANA does have the Code of Ethics for 2025. I would encourage you from leadership or just for your own learning, maybe to purchase this and look at these provisions maybe more directly. Provision 1, it looks at the nurse practices with compassion and respect for the inherent dignity, worth, and unique attributes of every person. 1.5, nurses are required to treat their colleagues, students, healthcare consumers with dignity and respect. These are old words, but they are such big and important words that really make a difference in our day-to-day walk, not for ourselves, but with each other. So compassion and respect. Do we feel that people are worthy? Are they valued? And do we demonstrate that to our colleagues? Provisions 2 and 3. Number 2 supports honesty, emphasizing the nurse's primary commitment to the patient. 3, the code underscores the role, promoting and protecting the health, safety, and rights of patients, which includes addressing questionable medical practices. It's so easy when it's easy, but what do we do when something does not seem to be exactly the right way? And we're the only ones standing there thinking that we need to either readjust, we need to recognize that there is a potential issue, whether it be with a procedure, a medication, not with just our fellow nurses and other disciplinaries, but with our physicians. And again, it may not be popular, but it is the right thing to do. Certainly being honest is important in our day-to-day decision making. Provision 4, the nurse's duty to self and practice. Responsible and accountable, again, these are 2 big words, for their own practice, make decisions based on sound judgment, and uphold the standards of care. Again, we know that. We may have to go back and reflect to see the specifics, but again, upholding those is imperative. This includes delegating tasks appropriately, maintaining competence. A nurse notices a colleague administering medication incorrectly. Provision 4 empowers the nurse to intervene and report the issue, protecting patient safety and professional standards. Again, we're empowered to intervene and to help make this judgment, to foster the patient's safety, and to adhere to the professional standards. I want to go back just a second when we talk about delegating. When we delegate, we want to make sure that those persons that we are delegating to understand, that they receive it, they welcome it, or they may have the right to say, I really don't understand this, so I am going to refuse. The other is what's delegated to us. We need to make sure that we have the competence, and if not, talk with that person who is delegating to us and share the reasons why we either need more information, we need more training, but the particulars would not bring about the patient safety and professional standards that we just talked about. The Code's 5th provision describes a nurse's duty to maintain competence and pursue professional growth, noting the difference between competence, which is a baseline foundation for acceptable practice and professional growth, an ongoing process for moving beyond this minimum standard of practice. If you're attending this webinar and plan on attending others, you know that our professional growth is ongoing because things are ever changing, and we can't stay where we were. We must continue to maintain that competence, and with that, the professional growth that will go with it. Provision 5 is again duty to self and others. Nurses owe the same duty of care to themselves as they do to others. Do we really take care of ourselves? I've said, and you've heard it, nurses take care of everyone but themselves. This includes personal health, integrity, continued learning, and self-respect. Nurses must avoid burnout and advocate for self-working conditions. A nurse feeling overwhelmed by long shifts and unstaffed staffing ratios can invoke Provision 5 to advocate for change, protecting their own well-being and patient care quality. We know change is not overnight, and we can get a little frustrated with that and a little discouraged. But when we need that change needs to be in place, we want to be an advocate for that, knowing that it may take a window of time. Actually, to really unfreeze something, going back to Lewin's theory, to freeze it back and to really get it in place usually takes at least 6 months. And that's with someone walking alongside a change agent in place in case things do go backwards, and we can move forward as we understand that change is not everyone is going to buy into it. The sixth provision describes a nurse's duty to act as a moral agent for creating an ethical environment. In 2021, the ANA Center of Ethics and Human Rights released a position statement, Nurses' Professional Responsibility to Promote Ethical Practice Environments. It directs nurses to enhance their awareness and sensitivity to the ethics content of challenges they face in their practice and take ownership of their ethical competence to address these challenges. Again, we need to be competent to not only understand, but to make a difference and have that awareness when things are not going exactly as they should. Provisions 6 and 7 are about the ethical environment and how nurses advance in the profession. The ethical environment, nurses must help create and maintain ethical work environments, include promoting transparency, collaboration, respect. Are we an area? Do you work in an area? Are you a person that people can be transparent, that you're going to respect and collaborate on the final outcomes? Or do people shun us and really think we are not going to be understanding, therefore they don't want to be transparent? Nurses should challenge unethical practice and support a culture of safety. If a hospital policy compromises patient dignity, nurses are ethically obligated to speak up and work toward reform. I would stop right here, ask you self-reflection. Does any of this resonate with you in your day-to-day practice for yourself, for your colleagues, for the environment itself? Provision 7, nurses advance the profession. Multiple approaches to knowledge development, professional standards, and the generation of policies of nursing, health, and social concerns. So these are where we advance our profession with ongoing learning. I consider myself a lifelong learner. Again, things change. I may not remember certain things also. So again, ongoing learning, certainly working with others, learning from others, and sharing. Provision 8 highlights how nurses build collaborative relationships with nurse colleagues, multidisciplinary and interprofessional teams, and communities to protect patients' human rights, mitigate health disparities, and achieve healthy equity. These are some really kind of simple words, but words that really carry a lot of meaning. When we look at patients' rights, we want to make sure health disparities are reviewed and mitigate that. And we want to really have and achieve the healthy equity. And here you have the link for the Code of Ethics. Provision 9.3 stipulates the role of nurses and the nursing profession in advancing the nursing vision of a good and healthy society. The code emphasizes nursing envisions a good society, not a perfect one, where dignity, respect, justice, and compassion are upheld for all. Again, here is the link where you can find more information regarding the Code of Ethics. I go back again, these are not new words, these are not a new language. This is something that we have all grown up with. It's a matter of how we've embraced it, how engaged we've been with it when we're looking at particular things of dignity, respect, justice, and compassion. And the key here is are upheld for all. Provision 10, again, I noted was new. Nursing through organization and association participates in the global nursing and health community to promote human environmental health, well-being, and flourishing. There's a scenario, Martin Sheen, a 15-year-old, and then there was another video that's out there on Josie King, which is an 18-month-old. I would ask you to review these on your own time. It really gives us some of the seemingly communication issues that we have that actually cost this 15-year-old and their 18-month-old their lives. And it was simply because people were not listening, communicating, really understanding that something was going really the wrong way and just lost time to make a turnaround in a resolution that would have been life-saving for both this 14-year-old who was a healthy soccer player and this little Josie who actually was burned, but other than that was doing healthy. And really the bottom line, no one listened to their mothers. And so how many times can we get busy? We don't listen. How many times can we think that they don't really know what they're talking about? How many times do we think we know more than someone else? I really would invite you again to look at these. When we put it all together, and this is from Martin Sheen, we realized that our son was the victim of a profoundly dysfunctional medical system. We had thought we were sophisticated consumers. Nevertheless, we gradually realized that we had sacrificed our firstborn child to a system whose dangers we had almost no way of knowing. The four core principles are non-malfeasance, beneficence, autonomy, and justice. These are not new to you. I'm sure at different, in your school of nursing, in your row where you are, these have been things that you've reflected on, you've been educated or re-educated on. I will highlight these and not spend a lot of time on them. When we look at beneficence and non-malfeasance, the difference between them is that one takes action to benefit others and the other refrains from acting in ways that might harm others. Beneficence consists of deeds of mercy, kindness, and charity. Its ethics-based nursing practice can transform healthcare practices. So we want that beneficence of mercy, kindness, and charity, and we want that non-malfeasance where we will not bring harm to others. Autonomy, one's ability to self-rule and generate personal decisions independently. This includes obtaining informed consent for treatment, facilitating patients' choice of treatment options, accepting patients' refusals, disclosing medical information, diagnoses, and treatment options to patients, and maintaining confidentiality. The fourth principle, justice, is a virtue in healthcare ethics and the foundation of a duty-based ethical framework for moral reasoning. It refers to fair distribution of benefits and burdens. The most common bioethical principle in justice is the allocation of scarce healthcare resources. Again, as the most significant human capital in the healthcare system, nurses are obliged to follow ethical principles in this field. One of these ethical principles is beneficence, which is considered the core of the nursing care. Informed consent Truth-telling and confidentiality spring from the principle of autonomy. Nowhere in the arena of healthcare ethical decision-making is conflict more pronounced than the principles of beneficence, and when they collide, it collides with autonomy. Withholding relevant information from patients that may guide them in making decisions about what course of treatment to pursue represents a violation of the patient's right to informed decision making. There are conflicts, and sometimes those conflicts are not easy to resolve. We want to respect the beneficence, malfeasance, autonomy, and justice. When these principles conflict, the specific details of the situation determine how they are reconciled. When faced with a conflict, Barkey notes that a physician must determine the obligation to the patient by examining the relative weight of the competing prima facie duties based on their content and context. There are 13 competencies in 3 categories when we look at nursing ethical competencies: moral integrity, communication, and concern. The moral integrity includes honesty, truthfulness, truth-telling, benevolence, wisdom, and moral courage. Communication is mindfulness and effective listening. You know, one of the most important things to remember in communication is listening is the most important skill that we can provide. Concern, advocacy, power, and culturally sensitive care. Again, this are not new words. This is not a new language for us, but something that we need to go back and reflect on. Moral integrity is often considered the fiber of other virtues. Features of moral integrity include good character, intent, and performance. Organizations can provide retention and moral resilience among nurse leaders by cultivating trustworthy behaviors. Nurses with moral courage advocate for or act upon ethical principles to do what is right, even when those actions create constraints or force them to do otherwise. Moral courage can turn into noticeable actions. And I want to go back to that again, that we advocate, that we have that courage, that moral courage that will turn into noticeable actions. Moral distress, a problem related to nurses feeling constrained by their workplace to act with ethical integrity. And one of the things that's noticed, it's easier to keep your head down than to fight a system that doesn't protect you. Research should explore interventions to mitigate moral distress among nurses by promoting safe staffing levels, adequate resources, and increased administrative support. Many of you, I was not, because I was actually still in the academic setting when COVID presented itself in 2019, and on 2020 really we felt probably more the effects. But again, there are so many things that I think follow to that and what we learned, and many of our nurses that did feel that burnout, lose that resilience, and so many unknowns that did occur, and how we had to make so many changes, even in the academic setting, to continue to teach at the level we needed to, because we could not go into the clinical setting. So I would just, as I'm kind of winding down here, just again, this is simple here with Mickey Mouse fishing, and he looks relaxed, and great scenery, but be brave enough to always, always, always do the right thing, even when others don't. That is so simple and easy with me sharing this today, you sitting there listening, but that is not easy to do. And especially if we don't have anyone else in our corner that agrees with us that it's not the right thing. Overcoming 5 dysfunctions of a team. I just want to mention this. This is from Patrick Lencioni, and he has other, his first actually was 5 dysfunctions of a team. So I've kind of blended them here. But when we talk about all these particular things that we're going to continue to work on and have the best outcomes for ourselves, for our peers, for patients, whomever, that we are in direct relation to the potential resolution and the outcomes. Having a team that can function and work together is very important. So this pyramid gives us some of the particulars as to functional versus non-functional. When we don't have trust, we're not going to have a functional team, but we need to cultivate trust. When we have a fear of conflict, we're probably not going to have a functional team. We need to encourage healthy conflict. Lack of commitment, we need to have and ensure that we are committed to our roles and help others make sure that they are committed. Make sure that we don't avoid accountability. We need to enhance accountability. And then we need to make sure that we have inattention to our egos and that we want to prioritize our results. So we want to have trust. We want to have conflict. We want to have a commitment. We want to have accountability for whom we are, where we are, and whom we are helping in our roles in the healthcare setting. And also for the prioritize the results and the outcomes. We know that making ethical decisions is no respecter of persons. And there's just a couple of things here, not to bring up anyone, but things that we can see where the best outcome is not what it needs to be. So Bobby Jones in 1920, what he actually aligns with Tiger Woods in the world of golf. But he actually was lining up for a shot, and his club brushed the grass, which caused him a stroke. And he continued to say he did it. The judges said no one saw it. He continued to say it is what it is. I did brush the grass, and so it was a one-stroke penalty. Ultimately, they finally said, okay, this is what you want. So he lost the game by one stroke was the end result. And sport writers heaped praise on his ingenuity, and they were like, okay, and he said, for you to compare me to someone that has really done more than I should have would be, well, to praise a man for robbing a bank. In other words, he knew it. So what do we know that no one else knows? So repetitive reminder, do the right thing when no one is watching, and it's called integrity. Again, it's not easy. It's not always one of those things that everybody's on task with and it's popular. And there may be some repercussions to it, but we still want to know to do the right thing. I'm going to do the right thing today, talking with each of you. What do I do when no one's watching, nobody would really care, and would it really make a difference, but it would not be the right thing? Here are the references to follow. I wish you the best as you move along in your healthcare profession. Both, I think many of these things can resonate from the healthcare profession, obviously, but even in our personal, to blend into our professional lives. Again, do the right thing even when no one is looking. It's called integrity. I wish you the very best, as mentioned earlier, in your walk, in your healthcare role. Thank you.